All this is Dr. Mubin Sayed from Drbeen.com. Welcome to one more show. So today we're going to talk about fluvoxamine. And I think that the cool beans, we all are going to fall in love with fluvoxamine just like we did for ivermectin. So I think you would enjoy this discussion. I believe we'll do this discussion in two topics. Today, we'll keep it high level. We'll look at the studies, we'll look at high level mechanisms and digest the basic way this drug can help us. And then we can do another deeper dive where we can see the mechanisms in more detail. Number one. Number two, I have seen some comments that they say there is a lag between the audio and video. So I think since this camera has been attached, there is a processing delay. So what I'll do is this: tomorrow I'll sit down and I'll look at how to synchronize this audio and video better. So my apologies for that time, but we will improve it. So with this, let's start. We'll do the same thing again. We'll do the discussion for fluvoxamine. Then we would stop that discussion. We can do chit chat later on. In this discussion, what you would hear is the following. Number one, you would see a study in which they have shown, it's a small study, but they showed that fluvoxamine reduces the clinical deterioration in patients significantly. Number one. Number two, you would see the mechanisms that can help with the neurological symptoms and with the inflammatory behavior of COVID-19. So I think you would actually like it. It is like ivermectin for brain. So you would enjoy this one. So let's start. And when I say ivermectin for brain, I don't mean in a negative way, in a positive way. Of course, we know that if ivermectin goes to brain, it can cause issues. But this is a drug which can carry similar behavior like ivermectin, but also is safe. It is actually given for psychiatric issues. So it is actually given to act on brain. So imagine, in my opinion, after reading all the literature and studies, my opinion is that ivermectin and fluvoxamine should be used together. One to help with the neurological symptoms, and the other to help with the remaining body. So that is how I see this combination. Of course, we're going to fall in love with this. The credit goes to Dr. Drew for this one, because he said that, hey, I am having good results with fluvoxamine for myself. That made me look deeper into this drug and look up the studies, and that is how we came to know this. So just credit back to Dr. Drew. All right, so let's start. You ready? So here, some of the links first. So this is Drbeen.com. This is fluvoxamine. Again, if you don't like Wikipedia, please search from your favorite site. Then this is the possible mechanism of fluvoxamine. I would explain that. This is serotonin, which is a neurotransmitter. It is not just a neurotransmitter. It is actually built by our GIT as well. It is manufactured in the GIT. It has effects on the GIT, on heart, and many other tissues other than just the nervous system. Then this is the endoplasmic reticulum. We are going to talk about endoplasmic reticulum today. Then this is the fluvoxamine study that I'm going to basically discuss today. And then this is modulation of the sigma-1 receptors. We'll come across sigma-1 today in the mechanism of action of fluvoxamine. And this sigma-1 is also, this mechanism is used in the study as well. So it is interesting to see this. And then is a couple of articles, the antidepressant fluvoxamine could keep mild COVID-19 from worsening. And then there is one more, comparative host coronavirus protein interaction network reveal pan-viral disease mechanisms. So in here, in this study, it is actually a beautiful article which talks about what are the reasons that in some people COVID becomes severe and in others it does not. So I think that this study itself deserves a complete separate discussion. In here, they talk about sigma-1 receptor as well. So I have that over here. And finally, this is another study cognition and depression, the effect of fluvoxamine, a sigma-1 receptor agonist, reconsidered. And they also talk about some of the things here for COVID. So with this, not just COVID, but with the OCD as well. So these are the things. I'm going to open up the study. We are going to go over this. So let's start. So here, what is fluvoxamine? Fluvoxamine is a drug that is called a selective serotonin reuptake inhibitor. What does that mean? Many of our neurotransmitters, especially, when they are released, some of them are destroyed and some of them are taken back up. So we have made, for example, a neurotransmitter. Why? To destroy it. Once we have thrown it out to do its function, we will then haul it back, we'll pull it back, and then we will release it again. So serotonin is such a neurotransmitter that is released to go and act on the next nerve. Once it has acted there, we then pull it back and store it in the previous nerve. And we'll talk about that. So the serotonin, selective serotonin reuptake inhibitors are those drugs that stop the nerve terminals or neurons from taking the serotonin back. The result of that is that serotonin is going to become increased in our brain tissue. And increased activity of serotonin in our brain tissue can actually improve our brain's functioning. Especially, it reduces the OCD, it reduces the depression, anxiety, phobias, and fear. It reduces aggressive behavior. It reduces extreme anger. So they have seen that in those patients who have a genetic problem with the reuptake pump that takes up serotonin, and it takes up more serotonin, for example, or those that have a problem with releasing sufficient serotonin, these patients have more aggressive behavior and they become more angry fast, and they become more anxious and obsessive quickly. Similarly, they saw that those mice, those rats in which they have knocked down the serotonin transporters, they behave better. And if they remove the serotonin releasing systems, then the mice become very, very aggressive. So generally, the function of the serotonin, if in the right quantity, if it is present in the brain, it keeps our mood balanced. It keeps us from OCD, obsessive compulsive disorders. It keeps us from depression, and it keeps us away from anxiety and phobias. So that is a function. So if somebody has, let's say, OCD or depression, how do we treat them? One of the treatment is to give these drugs like fluvoxamine, which will block the reuptake of serotonin, and the result will be serotonin in the brain tissue would increase and the person's mood will be balanced out. So that is what this drug is. However, there is another important part, another important function which is not done by many other SSRIs. This specific SSRI has another function, and that is that it is a sigma-1 receptor agonist. Agonist means someone who promotes the behavior of another thing. For example, when you support me, you are my agonist. If you do not support me, you are my antagonist. So agonists are those chemical substances that would support the function of another protein in our body. So fluvoxamine is not only an SSRI, it is also a sigma-1 agonist, which is an entirely different function and very, very useful for COVID. So that is what we're going to talk about. So these are the two functions. Please keep them in mind. My own assessment, after reading the literature and after seeing its effect on the brain tissue and on the inflammation, it behaves like ivermectin. Although it does not do anything to the virus itself like ivermectin does, but the anti-inflammatory properties and the balancing properties of the chemical substances are very similar to ivermectin. So to me, it seems like the protocols should be updated to add fluvoxamine with ivermectin, and they both should be given. I have to see drug-drug interaction yet, so we'll talk about that in my next talk, but these I think should be given together. So with this, let's continue. Here is a study. This study is this one. So this is November 12, 2020, so pretty recent study. It is a small study, 152 adults, not a very large study in terms of number of people, but still I think these are sufficient number to at least provide us a pointer in the right direction. And what is this study? Let's look at it. The study was done in Missouri and Illinois area from April 10 to August 5, 2020. There were total 152 people that participated in it. It was a randomized, double-blind, and remote study, meaning there was no clinical contact. People were given the drug or the placebo and prescribed that remotely. Then they went and got it, and then they used it. So again, there is a somewhat of a uncertainty. Out of those 152, actually only 115 completed the study. This study is still significant to look at. All patients that participated in it, 152, they all were COVID positive. They all had oxygen saturation greater than or equal to 92%, the ones that were included in the study. So why did they do that? They wanted to see that if somebody was at a relatively better oxygen saturation, and then they start giving them fluvoxamine, will they deteriorate below that or not? So that was the basic idea. So here what they did was, to one group, 80 people, they gave fluvoxamine 100 milligram thrice daily for 15 days. And they were measuring and observing for 15 days to see if there is any clinical deterioration observed or not. So 100 milligram fluvoxamine thrice daily for 15 days. Then there was a placebo group as well. That was 72 people. So 80 and 72. And here is what happened. In those 15 days, when they were giving these drugs, the fluvoxamine group had zero clinical deterioration. And I would discuss that. What did they mean by clinical deterioration? What were the endpoints they were observing? But there were zero people who deteriorated. Compared to the 72 here, out of them, there were 6 or 8.3% who deteriorated. So this was a significant difference. And what happened was the absolute difference between them was 8.7%. 95% confidence interval was from 1.8 to 16.4. So significant difference. In the fluvoxamine side, there was one serious side effect, 11 minor side effects. Interestingly, on the placebo side, and placebo was placebo, it was not another drug, 6 serious adverse events and 12 other. So to me, this simply means not significant, that there were 6 in the placebo and 1 on the fluvoxamine side. So now, considering that we know that there is a significant improvement from deterioration, the question is, what was deterioration? What were they thinking about? What were they observing? So let's look at that. What they were looking for was these two criteria. Number one, shortness of breath. So will the person develop shortness of breath? Or will they have to be hospitalized for shortness of breath? Or will they develop pneumonia? Remember, these were all the patients that were outpatient. They were already not sick enough to be in the hospital. So would they develop pneumonia or not? Then the second criteria was, will their oxygen level drop below 92%? Or will they need oxygen supplementation to keep them at 92%? So these were the criteria. And once again, if you go back to the study, in the fluvoxamine group, there were 0 people that met that criteria. Nobody deteriorated to that point. And in the smaller group, 72 people's group, there were 6 people in placebo that ended up with that criteria. So with this, now this is the basic. So yes, Luffy is over here. So this is the basic outcome, that fluvoxamine has beneficial effects. And not only for, so they have done this study for the outpatient patients. What I'm seeing is that long haulers are having significant improvement with this as well. I do not have a study yet. This is what I am hearing from various patients. Now let's see what is the effect of the fluvoxamine. What is the mechanism of action? So if you just wanted to see if it is useful or not, here it is. We will do one more deeper dive in which we'll talk about the side effects and we'll talk about the drug-drug interaction to make up our mind that how should we use this. But in my opinion, vitamin D's and Viptadil and ivermectin, zinc, quercetin, we should add fluvoxamine to that as well. It is a pretty safe drug, but there are some side effects. So we'll talk about those later on. Now, mechanism of action. and here, a small disclaimer, I will show you the study. Study is this one. This is the study. So and I have all the links present. The reason I am kind of smiling, the debacle of the clinical advisor to FLCCC on Twitter continued last night as well. So he kept telling me that I was baselessly making people worried about ivermectin. And in that process, he said that I am saying, me, Mubin, I am saying that baselessly, that if people take ivermectin, they will become chemically castrated. And this is a way to do arguments where you stretch somebody's point to such an extreme that it starts becoming irreasonable. And the other part of the argument is to lie. And when somebody lies, then the other one has no solution, because either you fall to that level of lying as well, or you just give up. So after he was doing those things, his objection, when I asked him, what is your objection? His objection was that the study that I talked about was in rats. So once again, this study here is in rats. But this was the study that provoked the authors to do the next studies. And normal clinical procedure is to, first of all, do a study on cells, if possible, then from there to animals, most commonly rats or mice. And these mice are genetically modified to make some parts of their tissue more similar to humans. And then from there to higher animals, for example, chimpanzees, and then from there to humans. That is a normal procedure. And if something fails in rats, it will not then be promoted towards humans. And similarly, if something works in rats, then it would be then taken forward. So this is a study that was done in rats as well. So from that guru, medical doctor, it would probably not be up to his taste, but it is an important study. So here is what the study is. So let's look at what's happening in this diagram. In this diagram, this is a cell's nucleus. So we are looking in a cell. And I have cut the nucleus of the cell here. This is the nucleus. Now, with the cell's nucleus, there are attached factories with it. These are endoplasmic reticulums. These are called endoplasmic reticulum. Endoplasmic reticulum are of two types. One are called rough endoplasmic reticulum, or RER. Rough endoplasmic reticulum have these little dots connected with them. These dots are called ribosome, and we have talked about ribosomes before. Ribosomes are the one that would take the messenger RNA and make proteins from this. What happens is, generally, what happens is that messenger RNA comes out of these nuclear pores. It is manufactured inside the nucleus. Then it comes out of it is rather dragged out of the nuclear complex. And then it comes in and attaches to the rough endoplasmic reticulum. Rough endoplasmic reticulum are the chefs of the system, and they would take an RNA and make proteins from it. And when they make proteins, they actually insert those proteins in the endoplasmic reticulum. So you can think of them as chefs that would make some food and then put that food in a special container or a box or a fridge or something. Inside there, when the food or the protein is placed, it is further processed. So that is the endoplasmic reticulum. Here, inside the and endoplasmic reticulum are of two types. If they have ribosomes attached with them, then they're called rough, because under the microscope they look dotty, and so we say they look rough. On the other hand, if you look at these tubes here, these are smooth endoplasmic reticulum. They are also endoplasmic reticulum. They're also structures in the cell, but they do not have ribosomes attached with them, so they look smooth in the microscopic presentation. What is more this all you can forget. What is more important here for us to remember is, in the rough endoplasmic reticulum, there is this little thing. If you see, I made him very angry. This is my attempt to try to make him a snake-like thing. There is an enzyme here called inositol requiring enzyme 1 alpha. This is an IRE1 alpha enzyme. This enzyme's function is to help produce cytokines. So we've been talking about cytokines all along, right? So macrophages make cytokines, T helper cells make cytokines, cytotoxic T cells make it, B cells make it, natural killer cells make it. Almost every cell can make cytokine, mostly immune system. This guy, inositol requiring enzyme, its function is to help make cytokines. Now, if we do not want it to help make cytokines, then we have to block it. And to block that, if you see in this part of the diagram, do you see that this is another little snake-like thing which is kind of dead? This is my way of showing a dead snake, this guy. So if you see here, this little enzyme is the sigma-1 receptor. This is another enzyme. This enzyme's function is to block or suppress or reduce the activity of the IRE1, this snake-like thing. So think about it. If the snake-like structure, this guy IRE1, its function is to make cytokines, and if you block it, then the cytokine production will reduce. So who blocks it? The sigma-1 protein blocks it. This protein also lives in this endoplasmic reticulum. So now think about it for a second. The messenger RNA came out of the nucleus. It went to the ribosome. Ribosome made proteins. Those proteins entered the endoplasmic reticulum. Inside there is the IRE1 that has a function of increasing the production of cytokines. Inside there also lives another chaperone or another protein whose name is sigma-1 receptor. That protein's function is to block the IRE1. Correct? Now enter fluvoxamine. Let's bring fluvoxamine in the play. What fluvoxamine does is, so if you see here, this little girl here is, or this lady here is fluvoxamine. Fluvoxamine, what she does is, or enzyme, it's really a drug, right? What it does is it supports the activity of sigma-1. So when sigma-1 agonism is done, when sigma-1 is promoted to do its function, what it would do is it would suppress the activity of IRE1. When IRE1 is suppressed, then production of cytokines is reduced. When production of cytokine is reduced, then inflammation is reduced, immune activation is reduced, and that is an important function of fluvoxamine that they found for COVID. This is a very similar function like ivermectin blocks nuclear factor K beta to reduce the inflammation and reduce the immune system related side effects. So here fluvoxamine, and the benefit of fluvoxamine is fluvoxamine can actually go in the brain safely and do this inside the brain. So the brain related side effects, the myalgias and the fatigue and the depression and anxiety and the fog, brain fog, can actually be reduced by fluvoxamine when given to COVID patients. Beautiful mechanism. I love this. Now, if I continue on, there is another mechanism which actually deserves a lot of detailed discussion, because what I'm going to miss in this whole mechanism is what is serotonin itself and how does serotonin function, where is it produced, how do we use it. So I'm going to leave that whole thing aside. Here is the second thing. Now imagine we are in the brain. This is one neuron. In the brain, what happens is neurons, they talk with each other. They talk inside the brain and they talk outside the brain as well. So what they do is, let's say this is one neuron. Neuron will have a long axon. Axon will have a tiny knob at the end, and that knob will end up on the other neuron. And what will happen is, in this area, one neuron will release chemical substances which will then trigger the next neuron, and there will be action potential. So usually what happens is, a neuron has electrical activity in it, but once that electrical activity reaches its end of the axon, there it is converted into chemical activity and chemical substance is released. That chemical substance would go and irritate or trigger or block, it can do many things, the next neuron, and either the next neuron will start having an electrical activity or it will be blocked from having the electrical activity. So this is how the brain tissue works. Now, with this mechanism, the diagram you're going to see is the diagram of this area. So here, if I go back to this diagram, this is one neuron and this is its end. This is another neuron and its beginning. So now what happens is, this neuron releases serotonin in this is called a synaptic cleft. The space, so let's say this is, if you can please look at my hands. So imagine this is one neuron and this is the other neuron, and they both are connected like this. The space between them is called synaptic cleft. Their connection is called synapse. So in the synaptic cleft, one neuron will release serotonin. That serotonin will go to the next neuron and act on it and do whatever function it wants to perform. Then the previous neuron, let's call it neuron A, and then this one is neuron B. The neuron A is going to say, you know what, I want to take my serotonin back. So it has a transporter here. This black thingy is a CERT, serotonin transporter. This transporter, its function is to take the serotonin back. So how does it do it? Inside, it is a cross-membrane transporter. That means if my hand is a cell, part of this transporter is inside the cell and part is outside the cell. So now what happens is, on one end, on the inside of the cell, potassium connects with it. On the outside of the cell, sodium chloride and serotonin connects with it, and then it moves, it flips. And what happens is, the sodium chloride and serotonin end up inside and potassium ends up outside. It is an energy dependent process. It's a potential dependent process. Leave that part. Just the summary of this mechanism is that there is a transporter whose job is to take serotonin back up. So once the serotonin is taken back up, there is less serotonin in the synaptic cleft, and we would need more serotonin again to be released. And then once again, in some people, when there is less serotonin here and they needed a little more, so let's say it is lesser than normal levels, then they would develop aggression, anxiety, fear, phobias, obsessive compulsive disorders, depression, and so on. So what do we need to do? We need to block this transporter and reduce its function from taking up the serotonin. So how do we do that? There are many drugs. One of those is fluvoxamine. Fluvoxamine, if you see here, this drug has blocked the function of this transporter. So this is what selective serotonin reuptake inhibition. So this is the SSRI function, SSRI. So now that it has blocked this transporter, the transporter cannot work. And once the serotonin is released, it stays in the cleft and in the brain tissue. And increased levels of serotonin improve the psychiatric state. It improves the brain fog. It reduces the depression. It reduces anxiety. It reduces phobias. It reduces obsessive compulsive disorders. And that actually makes a person much better operationally from thinking point of view. So this is the second function. So now think about it. Many COVID patients, especially long haulers, develop neurological symptoms. These are because of the lymphatics, or these are because of antibodies going in there. These are because of, I believe not, but let's see, maybe the virus itself there. I don't believe this statement that I'm making, virus itself there. I've not seen that study yet. But something is happening, and fluvoxamine helps there. So once again, I think that it should be given to long haulers, but it should be given early on as well. And because it is a rather safe drug, and because it actually helps with the mood balancing as well, I think there is, and again, this is not a prescription for anyone, I think there is no issue adding fluvoxamine to many people's prophylactic regimes as well. So this is the discussion for the correct. So some are not serotonin inhibiting, but I wanted to make sure that we realize the function of fluvoxamine in this behavior. Some of the serotonin promoters actually improve the production of serotonin. Some reduce the production of, reuptake and so on. So there are many kinds of drugs. So these two mechanisms, I love these mechanisms. I love this one. This is a rat study though. I am totally on board with the rat study, meaning for the legitimacy of these studies. But apparently there are doctors who do not understand that these things start that way. And I actually think, I'm going to now once again criticize that doctor. I think that this is what happens when we try to dig in to our own corners, and then we want to dispel everything else. And that is not the right thing. Okay, cool. So this is done. I'm going to look at some of the comments here. Maybe we can break here so it stays a shorter video. People can watch it and digest it more easily, and I can come back for the chit chat in a second discussion. John, thank you very much for the super chat. This is exciting. Thank you. So I'll talk about side effects tomorrow. Side effects are not too bad. Constipation, diarrhea kind of things. I'll talk more about that tomorrow. So one person, once again, I think it is sort of unfair. So is Luffy a sertraline chew for his OCD? Absolutely will do. Magnesium is great. Yes, absolutely. One of the person is Dr. Drew, and his message to him, I hope he doesn't ask me to cut these parts of the discussion, but if I go to Dr. Drew's message, he was taking it himself. And he had said to me, amazingly stops at tinnitus within 30 minutes. For 3 hours, it gives a lots of energy and improves. Sigma-1 agonist shuts down inflammatory response. Pretty interesting. And so this is the his opinion or his own experience, and I've seen similar experience from other patients too. That is why I wanted to talk about it. Dr. Drew was the one who actually asked me to look into it. Okay, so how about I come back? So in this study, they used 100 milligram thrice daily. All right, so let's do this. Let's close this chat, this discussion, so this stays manageable, and I'm going to come back. Let's see who is the first one. So the customary messages: if you like the work I'm doing, please like, subscribe, and share. And secondly, if you would like to be a Patreon, there is a link in the description for that. If you would like to buy me coffees, there is a link in description for that. And if you would just like to support this channel as well, there is a link in description for that as well. Thank you very much, and I'll see you shortly.